reiterate, AIDS is caused by an external virus invading the body, while OCD is fundamentally an internal condition, deeply rooted in the complex biology and chemistry of the brain. Therefore, it's essential to emphasize that you simply cannot catch OCD from someone else, as you might catch a cold or the flu. The connection between the two conditions isn't one of direct causation, one does not directly cause the other, but rather one of shared psychological theme. The very real and significant threat posed by HIV can, unfortunately, become the central focus of intense obsessive worry and anxiety for some individuals, and subsequently trigger compulsive behaviors as a way to manage that anxiety, manifesting as OCD. This overlap underscores the powerful way in which physical health fears and anxieties can profoundly drive and exacerbate mental health struggles, highlighting the intricate connection between mind and body. Therefore, understanding both the fundamental differences and the potential connections between these conditions is absolutely key to providing effective and targeted care for individuals affected by either AIDS or OCD. So, with that in mind, let's take a closer look at how doctors go about identifying and diagnosing each of these distinct conditions. Diagnosing AIDS and OCD, while both serious conditions, involves very different approaches. One relies heavily on biological markers and laboratory testing, while the other is rooted in understanding a person's thoughts, feelings, and behaviors. It's a fascinating contrast in how we understand and address health challenges. AIDS diagnosis starts with testing for HIV, usually by detecting antibodies or the P24 antigen in blood or saliva. These tests are designed to identify the presence of the virus even in its early stages. Testing positive for HIV doesn't mean AIDS. AIDS is diagnosed when the immune system is severely damaged. This damage is specifically measured by the decline in CD4 cells, which are crucial for immune function. Doctors look for a CD4 count below 200, which indicates a severely weakened immune system and a high risk of opportunistic infections, or the presence of certain opportunistic infections. These are infections that typically don't affect people with healthy immune systems, but can be life-threatening for those with AIDS. OCD diagnosis is clinical, not biological. There are no blood tests or brain scans that can definitively diagnose OCD. A mental health professional evaluates thoughts, feelings, and behaviors, carefully listening to the patient's experiences and concerns.